Good afternoon, everyone. Thank you so much for attending the Office of Diversity, Equity, and Inclusion's Lunch and Learn. My name is Leandra Tracoros, and I am the Diversity, Equity, and Inclusion Administrator in the Office of Diversity, Equity, and Inclusion for Franklin County Board of Commissioners. July is Minority Mental Health Awareness Month, and we wanted to take the time to discuss the importance of mental health, specifically how to navigate assistance and support, as well as provide insight on the barriers and challenges that minority groups encounter when accessing care. According to the American Psychiatric Association, ethical and racial minorities often bear a disproportionately high burden of disability resulting from mental disorders. People from racial and ethnic minority groups are less likely to receive mental health care. For example, in 2015, among adults with any mental illness, 48% of whites received mental health services, compared with 31% of Blacks and Hispanics, and 22% of Asians. A new study from Nationwide Children's Hospital, published in September 2021, shows that Black children ages 5 to 12 are twice as likely to die by suicide as their white counterparts. We are in the midst of a mental health crisis, and today we will not only raise awareness and discuss the disparities that exist, but we will discuss breaking the stigma surrounding mental health. I would like to take time to thank our Board of Commissioners, President Commissioner Crawley, Commissioner Boyce, and Commissioner O'Grady, for acknowledging and supporting these important conversations, as well as our County Administrator, Kenneth Wilson. I have the great pleasure of introducing today for our conversation, Gina Amador McDowell, Behavioral Health Clinic Education Supervisor from Nationwide Children's Hospital, Dr. Amina Kimvor, Vice President of Advocacy and Engagement from Adam H., and Rochelle Martin, Executive Director of the National Alliance on Mental Illness, also known as NAMI. Welcome so much, everyone, and thank you all so much for taking the time to speak with us today. If I could, I'd like to go ahead and get started with the questions. And my first, to begin, could you please educate us on how prevalent mental illness is and what causes it in children and adults? And are there indicators and signs that we should be aware of? And I'll open the door so anyone can answer.
Well, I'll jump in. So this is one of those things where I said, let me just make sure that I'm caught up on a lot of this. So some years ago, I guess the prevalence rate used to be 1 in 4. Does anybody remember that it was 1 in 4? Now we are, yes, we are 1 in 5. And the National Institute of Mental Health separates that prevalence into 2 different categories. One of those being any mental illness, and then the other one being severe mental illness. And so persons can, exist in one or both of those with regards to an actual diagnosis. And another question that we kind of get usually, I know my colleagues will co-sign on this, is, how does a mental illness, if you will, actually develop? Where does it come from? What should we be looking for, with regard to this? And it could be genetic, meaning that it's inherited just through your genes, your brain chemistry, your environment. You can be exposed to a trauma, for example. And then there's a plethora of things that we probably should all be looking for with regard to whether or not we could potentially have a mental illness, or maybe just really be struggling like we've seen during this pandemic a little bit more than we have in the past from doing, basic things like household chores. Going to the grocery store is completely exhausting now, right? Engaging with friends, don't really want to do that anymore. Not eating as much as I should, not sleeping well, sleeping too much, not sleeping enough, productivity at work, confusion, difficulty concentrating. I don't want to list everything on here. I'm sure my colleagues can kind of jump in and start to kind of keep that trail of thought, going. But with regard to the prevalence component, that's pretty much where we are now. And there is a significant difference between the any mental illness versus the severe mental illness. So any could be, depression, anxiety. Severe could be something more of like schizophrenia, psychotic disorder, or severe PTSD.
Thank you so much. Thank you.
And I would like to add some other thoughts about indicators or signs and symptoms. Thinking about suicide, avoiding friends and social activities, inability to carry out daily activities and handle daily problems, and an intense fear of weight gain or concern about your appearance. So Gina may have some that she wants to add about kids.
Yes, when it comes to kids, we always say to parents, when you notice, you know your child best. So when you notice a significant shift from the norm, so everything that has already been shared, we really look at things like withdrawal, kind of avoidance of certain activities, especially if they're things that they used to enjoy. But we also say to be mindful that there are things that kids developmentally grow out of, right? And their interests do shift. But when you start to see that shift in mood, maybe a little bit more of that anxiety or fear that's bubbling up, that's when we kind of know that there's something happening. There could potentially be something going on. And as far as statistics, you mentioned suicide. I mean, we have seen an increasing rate of youth suicide over the past several years. And again, and also an increase in the suicide rates of our youth of color. And so these are things that we're knowing that we need to pay attention to these signs early and really break that stigma around these conversations. Because, the earlier that we can identify the signs, the hope is that we can intervene so that we're not getting to that point. So we're just seeing such an alarming increase. COVID had a huge impact too, when we're talking about where does it come from? Environment obviously can be a huge impact. And I think the world as a whole has been through a trauma, and so I think there are just so many things, stressors that could be here now that we're just seeing a large increase of anxiety, depression, and unfortunately suicide rates. Oh, Leandra, I think you're muted.
Of course I am. Thank you.
We're still trying it.
Yes, we're getting it.
Speaking of COVID,
Yes, exactly right. And that definitely helps go into the next question. Does mental illness affect men and women and boys and girls differently? And do you notice trends among different racial demographics?
So I'll take it. When it comes to mental illness, the sexes are different. Women are more likely to be diagnosed with anxiety or depression, while men tend towards substance abuse and anti-social disorders. And this is according to the American Psychological Association. And Dr. Kay, you may have more that you might want to add to this.
Yeah, I can just piggyback right off of that. So great call out regarding anxiety for women. What I will say, statistically is that women tend to seek help, more often than men as well. So we have to think about that when we're thinking about the actual output of the numbers, right? If women are seeking help more, then obviously our statistics are going to be higher with regard to the help that we are seeking. But to add to what Rochelle was sharing, women, more likely to be diagnosed with anxiety and depression, that's seen through intense anxiety, which could potentially lead to, loneliness, worthlessness, and then there goes the depressive part. The behavioral component regarding men who, as Ms. Rochelle shared, tend to fall more into that space of substance abuse. You may see behaviors such as aggressiveness, again, antisocial, and possibly depression, but the depression is being coped with more likely by men through using a substance, and we call that self-medicating. So instead of reaching out, possibly asking for help, which men statistically are less likely to do, in America, we are socialized in this way. So that's not a surprise. However, the intensity of their symptoms may then be a little bit more severe and a little bit more outwardly expressive. So if you think about, I'll think about male clients that I've had who have come in because their spouse or family member has said that, they've just been really angry and aggressive, lately. Well, there's usually that underlying component of some type of depression happening. What specific type or criteria, that they're struggling with may vary, but those two things do go hand in hand most of the time.
From a child and adolescent standpoint, previously young males, those who identified as young males were, we kind of see that as a higher suicide risk. However, the gap has been closing on that between those who identify as young male and young female. We are seeing that gap close. Another interesting statistic is that since COVID, there's been about a 40%-ish increase in mental health visits to the emergency department between 2020 and 2021. And those visits in the US that were for suspected suicide attempts were 51% higher for adolescent girls and 4% higher for adolescent boys compared with rate when they were compared to 2019 statistics. So kind of going back to that point of what you said, there might be more seeking of treatment from when we're thinking of adolescent females, but it's interesting to know kind of what causes those numbers. But we did see a pretty big spike in both male and female emergency visits for mental health related concerns.
Goodness, thank you so much for sharing that. Once a diagnosis has been reached, it can be very overwhelming and scary to determine what to do next. Could you discuss maybe the initial steps to take prior to a diagnosis, as well as after someone has been diagnosed with a mental illness?
I can kick off with this one. Prior to a diagnosis, I think, especially if you're waiting for services, really just want to reinforce about having the conversation with kids. Whether that is from a caregiver standpoint, if you're in the classrooms, how can you just kind of like bring up these conversations related to just feelings and overall mental health. And I think that goes back to that breaking that stigma, like let's have these conversations. For families while they're waiting for a diagnosis, that can definitely be a very anxiety producing time. And so I think just, again, keep continuing to educate yourself, checking in with your child, know what your resources are as well while you're waiting. And then once you receive that diagnosis, again, trying to get as much as education as you can from that trusted source. And, again, reputable source. And so, if you're waiting on a mental health provider, even speaking to your, the pediatrician or primary care provider to even gather as much information as you can to see what supports are out there, because sometimes there are groups that could be available or resources in schools. And I think, just being able to kind of tap into all of those resources once you kind of get that diagnosis.
So I think that, if I just kind of think through the trajectory and the experiences that I've had in this space, I first of all count it a complete honor and a privilege that a client, someone that I don't know, would reach out and be able to sit across from me, a stranger to them, with a degree and a license behind my name that says I can help you, that's always been fascinating to me. So I kind of absorb folks in that space. And I think about, first of all, what did it take for them to even make that phone call, to even reach out for help, and then when they do, they get me. And so what is my approach going to be, in that space? Because I can't control for what happened before they got to me. But, once they've, come in for help, the biggest thing that I can do in terms of, listening, being there, all the therapeutic, 101 things that we do is believe their truth. In that space, I feel like that is what helps to move healing forward. And so once someone has actually made the connection and they are aware at some point, that something's happening to which they're coming in, I like to call it spiraling out of control, right? Like I can't get a grasp on any one or two things in my life right now. I feel like things are spiraling and I need, further assistance. And so, a lot of that can include, at least what I've done with my clients, is empowering them, educating them. And in education, I'm teaching them how to advocate for themselves. Someone is very severely depressed or has a severe mental illness or a co-occurring, meaning that you have a mental illness as well as a substance use disorder, may not always be in the right mental space to be able to truly understand the system of care they're in, let alone be able to advocate for themselves in those. And so similar to what Gina was saying, we have to empower in that space in order for people to feel confident that when they're not with you, they have the structure knowledge of what they need to be able to move forward. Second to that, I will say that language is everything. And I'm not just talking about, whether English is, your first language, or if another, language from your cultural community is in fact your first language. That's one part of language, right? The other part is the language of mental illness and the language of addiction. We have to know what those words are, what they mean, and what that feels like for our clients, for the people that we are serving, so that we're equipping them to advocate for themselves moving forward. In addition to that, for clients who maybe do not speak English as their first language, I'm married to someone who's from a different country. Some of the mental health language that I use does not even exist where he is from. So it's like trying to, how do you say this in this language? And it's like, we don't have that. And so thinking about the diversity and the complexity of our beautiful Franklin County, we have to keep even that part, in mind. So language is a huge part in this entire scope of, getting services and then being able to receive services that truly do meet you where you are.
I think lastly, to say is that the therapist may not diagnose you right away. It may take some time for that to happen, and to be patient and have grace with yourself as you wait. So.
That's
Thank you.
powerful.
Yes. What can schools do and employers do to support those with mental illness, both prior to a diagnosis and after a diagnosis is made? And what resources are available for professionals and families?
I can jump in with that. So this one I've struggled with over, the decades of service because mental illness, is an addiction is very tricky, very, stable at times, very unstable at times. We're all, whole emotional beings, and we are trying to navigate our world as best we can at home, at school, if we're in school, at work, if we've also added work, to the plate, family, all of these different things. But going back to like those symptoms that we listed that led us into the conversation about seeking help, inside of that would be connecting with whoever your direct care provider is, whether that's a therapist, whether that's somebody who's providing medication to you, to talk about the struggles that you are having so that they can help you advocate for yourself within a work environment, within a school environment. There are laws that are protective, for all of us with regard to, physical illness, mental illness, people getting appropriate accommodations where they are. Where I've seen clients struggle the absolute most is when it comes to a point where they'd have to be vulnerable with their employer and expose themselves and say, I have this mental illness or I have this addiction, but I'm in recovery, and not, and worrying so much about like, oh my gosh, what's going to happen? Are people going to look at me differently? So it's like that stigma rollback just keeps on, coming. And so I've seen it go over very well with very large, companies, organizations, and clients I've had. I've seen it go over well still with smaller ones, but it's really just that individual's ability to overcome that, what they may see as kind of like a barrier, kind of like a fear, structure in place. Like, oh my gosh, I gotta go tell, this whole HR department that this is what's going on with me in order for me to get the support that I need in a work environment. Also in a work environment, employee assistance programs. Most, especially large employers, have those. So having a great provider on your side that can support you in times where you may need to access that care is critical as well.
And I would like to add to that employers at this junction need to make sure that they help to educate their staff on mental health. And one suggestion that I have is mental health first aid. It is available, and it would be great for organizations to invest in it for their staff. The one thing I want to say, and Gina, I'll let you go, is to say that NAMI Franklin County, I have invested in therapy services for the staff that work with me. They have a therapist and they are welcome to use it and to take advantage of it. And I think that is some way of really investing into your staff.
Absolutely. And I think, both school and organizations, going back to that removing stigma around mental health, I think acknowledging that we all have mental health, every single one of us, just the same way as we have physical health. So, needing to acknowledge that your mental well-being is just as important as your physical well-being when it comes to going to school, doing your job, whatever it might be. And, again, like you said, providing resources about where you can find help, but also, making it a part of the either the school culture or the workplace culture too, that self-care is important. It's not just something that we do when we're stressed out. Really trying to provide that environment and that promote that culture of like, this is something that we're doing on an ongoing basis. And then when we get to the point where we're not feeling well, just as if we were not feeling well, if we were sick and we would go to the doctor, here are the resources that you can utilize in order to help. And in schools too, I think there are a lot of opportunities to promote and foster conversations about mental health. And I don't mean, very sensitive topics amongst children. I mean, more of normalizing the discussion around feelings and emotions. And it's okay to feel sad. It's okay, and if you aren't feeling well, we have resources here. So I think just being able to start normalizing that conversation, just as we would normalize if you need to take a leave of absence because you're physically ill. Again, you had mentioned that people are very, can sometimes be very intimidated by talking to an employer about if this is something that they need to take some time. Normalizing that our mental health is just as important as our physical health.
I want to do a call out. I was on, I think, LinkedIn, and I made a note of this because it was pretty powerful. There was an article that came across my thread called Coming to Terms with My Mental Illness, an article by NAMI. Did you read it, Ms. Rochelle?
I did not, but I will.
Yeah, so NAMI puts out really great quality articles to this regard. And so a couple of highlights from that were really about this person sharing their experience with their mental illness from, the time of diagnosis all the way through to hope and healing. And so I called out a couple of things that I read. One was that when they got diagnosed, they were hit like a boulder, realizing like, oh my goodness, not only am I this person, I've got a whole nother identity that's now been added to who I am as an adult. And I need to figure this out because I don't feel well. So that's huge. That's a very impactful moment. Then they led further into, how do I cope with my symptoms? How do I do that? Do I go see a therapist? Do I need medication? Do I need to be around friends, family? And out of that rolled over into finding my community for them, finding people who, understand me, maybe look like me, get, what mental illness, is. And thankfully for this person, ended with a section that talks about just their future and that there's hope, in that. And so I wanted to just kind of call that out because I love what Miss Rochelle said about the mental health first aid and what Gina, piggyback to kind of wrap that around. But truly being able, if you don't have a mental illness and you can't understand what the weight of that feels like, but you can educate yourself through a variety of different trainings, be them, a lay person or clinical or not, just to try to further your understanding that will, individually and then collectively help us to reduce that stigma that we are just continuously find ourselves battling against.
Thank you so much. Thank you. And we do realize that caring for someone with a mental illness can be very demanding. Could you please discuss some services available for caregivers?
I'm looking at you, Miss Rochelle.
Okay. So NAMI Franklin County does a whole array of services. For families, we have what is called the Family to Family class. It is 8-week long class. The family member gets a binder of 1,000 pages. It is taught by a family member who has a loved one with a mental illness. A couple of things that they learn in the class is how to communicate with their loved one who has a mental illness. The different referral sources that are available in Franklin County. And the Adam Board funds over 30 different agencies to provide help for people with a mental illness. So we have just one more that I want to talk about. There is the peer-to-peer classes. Those are designed for people who are living with a mental illness. And those classes are taught by someone who is living with a mental illness. And the same type of structure is designed in that, but it is devoted towards them and how is recovery possible. I just love my work at NAMI. Those are just a few things. And you can go on our website to learn about all of the rest of the things that are available. Thank you, Dr. K, for bringing it.
I had a feeling that you would want to do a specific call out in that space. And thank you for sharing that. Yes, the Alcohol, Drug, and Mental Health Board of Franklin County is connected to over 30 network providers here locally, just in Franklin County alone. We're in all 16 school districts providing school-based prevention work. I'm sure Gina's familiar with that. And they're on our website, which I know will be shared after this particular segment. You will be able to filter through our different providers based on your need and be able to locate someone across the whole county that will be able to support you, support your family, support your children who are enrolled in the schools that our network providers are providing services in on a regular basis. I'd be completely remiss if I didn't mention the wonderful collaboration that we have with NAMI Franklin County, specific to the faith community. And so we do know that there are faith communities of all faiths here in Franklin County that we are and still continuing to tap into, that are available to provide some of those learning environments that Ms. Rochelle was alluding to, that really kind of conceptualize and help the whole family to understand what mental illness is and what that looks like for their family member. In addition to that, and I won't get into too much detail on this particular component, but Adam H is leading right now the construction and of a new mental health and addiction crisis center We plan to do a groundbreaking this year with plans to open and, do a ribbon cutting in 24. And these are some of the on-site services, the peer support services that Ms. Rochelle just mentioned, having someone who has experienced what you're experienced being there to connect with you as you enter, as a warm handoff when you go, and then having someone to also sit with your family while you are maybe in crisis and educate your family about what you're going through. All of these things are critical. I've worked in crisis, I've worked in hospitals, psychiatric hospitals. I truly understand what that lens looks like. And so I am so excited that being able to lead in this space as a behavioral health county board, we are able to kind of just direct our lens of focus in areas that really help to support the work of what that person will need, not just while they're there, but especially when they leave.
Absolutely. And, I think that is such an amazing program. We do know caregivers take on so much, and oftentimes their own self-care takes less of a priority, just because, of all of the demands, and most of the time it's just that caring and wanting to make sure that their loved one is okay. And oftentimes their own self-care suffers. And we know that you can't pour from an empty cup. So being able to provide as many resources for caregivers, whether it is in a time of crisis or even just their everyday life. And on our sleeves, when we're talking child caregivers, on our sleeves, which the website will be provided, we have created, it was born here at Children's, but it is now this national initiative all over the country, with providing free educational resources to caregivers, advocates, educators, on just how can you educate yourself on various behavioral health topics. What do you kind of need to know that, again, can help support you and your everyday life? I mean, again, not just talking about when we're in crisis, but in your everyday life, working with your child, those conversations with your child, how can you continue those? And then also, I think just really for child caregivers too, knowing what your resources are if there is a crisis, because absolutely that can feel a time that you don't even know where to go, don't know what you need. It's just this period of, I want my child, I want my loved one to be okay. And here at the hospital, we run the Franklin County Youth Psychiatric Crisis Line out of the hospital, and oftentimes we'll have caregivers call to consult because it's just, I don't know what to do in this scenario. So I think there's kind of the twofold of just knowing how can you continue to support yourself as well throughout your everyday life, and then knowing your resources ahead of time if there is a crisis. Who can you lean on to help you kind of navigate that crisis and know what your next steps can be?
I want to add just one more thing to that, because I think that was so profound. I don't want people to think that the only way that you can take good care of yourself is by having to be able to afford treatment, for example. The ADAMH board, we, fund network providers and take care of all of our Franklin County residents, regardless of their ability to pay. I think what this pandemic has kind of forced us, in addition to be able to do, is be, a lot more innovative in how we care for ourselves, especially when we were kind of on lockdown. It was like, okay, I can't go anywhere. What can I do? I can take the safer choice and do something healthy, or I can do something, not as healthy. And so thinking through, even with family and friends, having conversations about, so what are you doing to take care of yourself? Like, the biggest question we get sometimes is, there may be a wait for services, which is, pretty much normal right now, but that doesn't mean that you still can't take care of yourself. And so being able to have those connections, like you said, Gina, with family and friends, to kind of talk through what are some practical things you can do at home I love when clients say these are things I can do by myself, because that means that it doesn't depend on someone else before you're able to be successful in that space. But keeping that in mind too. So I want people to be encouraged that there are still, think through things that you can still do to take care of yourself while you are called to take care of someone else, that may not, have to do with you, getting, professional services. There may be innovative things that you can do right now that can be just as supportive while you're waiting for, ongoing treatment.
So may I just add one more thing too? We have been seeing a great deal of people calling us from all around the country needing our services because their loved one has left home and moved here and they need help. I've had at least 4 or 5 families. They have joined our support group virtually, and we navigate how to care for their loved one that is here while they live someplace else. So as Dr. K said, we have to be thinking way outside of the box of how to serve people.
Absolutely. And thank you all so much. You brought forward a very important discussion when we're talking about a crisis. What resources are available to those that are in the midst of crisis and need immediate care and additional attention? What can we do for ourselves and or our loved ones?
From the child and adolescent perspective, I think, I brought up the Franklin County Youth Psychiatric Crisis Line, so that's always available 24/7. So I think that is something that is a resource for both the children and teens, but as well as the caregivers too, if there's something, if there's something going on that they need consultation as far as whether or not they should go to the emergency room or the crisis department. We have our psychiatric crisis department here at Children's that we just opened up in March of 2020. Knowing that, that's not the only resource available. And that's what I always tell families, know what your local resources are, who can you tap into that's in your community? What is an emergency room that might be a good option, and trusted resources in the community. And talk with your primary care provider as well and see what they would recommend. So I always think of having kind of a safety plan on hand as far as if this were to occur. Do your research and kind of just making sure that you have those things available, because in the time of a crisis it can be really hard to navigate that. So if you have these things available on hand, when something like that occurs, then it's easier to utilize. We also give out for children and adolescents, and I'm sure you do for adult services as well, but thinking of the National Suicide Prevention hotline. There's now a text line too. So there are many resources available for anyone that's experiencing this type of crisis.
So crisis is it's a loaded question. It has been for a long time. Sometimes I feel like if you're in crisis and you contact a crisis line, you need to be ready to mobilize. That's a possibility. I mean, you're reaching out for care at a time where you probably are most vulnerable, and you're relying on that person on the other line to be respectful of that and understand that and give you good direction in that space. And yes, we have the National Suicide Prevention Lifeline, not hotline, Lifeline. Oh no, I didn't even know you didn't say that. I was just saying life because I like to put the future orientation into the conversation, that there's hope. So that's why I always make sure to say life in the Lifeline. But then now we have the introduction of 988 for folks who are in a mental health or substance use or addiction crisis, can call 988 and get a trained mental health professional on the line that can provide some, good guidance, kind of pick through what's going on and determine what the next step may be. The next step may be someone who's also trained in mental health coming out to the home to provide, face-to-face support, really be able to determine, what next steps need to happen. And it could be, further services at either a hospital or a local crisis center. So, just an experience alone, that ability to actually, kind of mobilize in that space is something that we need to be thinking about if we're calling for ourselves or for someone else. Even from a therapeutic, standpoint, I found it easier over the years. Hopefully Gina can co-sign on my statement here, that the more you can educate your client or that family in the midst of a crisis about what to expect, about why this is happening, about, what is the next step, the more you equip them with the reality, whether they can take it all in or not at that moment, but just being able to equip them, with the reality and the support that they need in the midst of the crisis, I think it just goes over so much better than it would if you just, they're in a crisis and you just end up, sending them off somewhere. That's not really all that helpful. But yes, reaching out unashamedly to contact, 988, to contact the Lifeline, Suicide Prevention Lifeline. And then layperson reaching out to family and friends. Like, it's still okay to call a family member or a friend that you might be close to just say, I'm struggling today. I'm having a hard time. I don't even know how I feel right now. This happened, that happened. I feel like I can't, get a grasp on this or that. So think about if you have a trusted person that you can talk to, walk through some of those experiences with, that may or may not lead to, a formal call out. So lots of ways to handle crises.
I agree completely. I think it's so pertinent to have those conversations and create those plans in a non-crisis state, because you're right, there are so many supports out there that sometimes people don't even realize they have, like internally, family, friends, people that they can trust. And if we can identify those early on, both from a child perspective and from adult perspective, even if you are the caregiver, it's so much better to be able to identify those internal supports and certain, just people that you trust, because when that does come, it is much better, as you said, than kind of, I mean, of course we have the lines there and we have those resources available because we need them. And sometimes that's necessary, but you're 100% right. I think that if we can kind of empower people to identify those supports, it might not even be necessary.
So NAMI Franklin County provides families with tools and skills. One that comes to mind is to document everything that goes on and keep that documentation available. So when the crises, if and when the crisis comes, and you have to call a CIT officer, you can say, these are the things that have been going on, and these are the dates and the times. And also, I would just like to give an example of a family member who contacted NAMI Franklin County, and I received the call, and she was so angry. And it took me at least 45 minutes to calm her down, to even trust me that I will guide her in the right direction to get the services that she needs. I finally got her to attend our support group, and she met all of these people in the room that could help her and said they were willing to be a support to her. And now we have developed a friendship. She's no longer angry with, I took it that she was angry with me, but we had developed that rapport. So those are some things that came to mind for me.
Absolutely. Thank you so much. If we could please discuss barriers that individuals and families face when they are in need of help, and how diversity, equity, and inclusion plays a role in mental illness.
Another loaded question.
I'm getting good at that, aren't I?
You are. You're such a wonderful moderator. So this is okay. It's kind of like twofold. Your question. Diversity, equity, inclusion. For me, for even the Adam H board, it's everything for us. It's embedded in the work that we do on a regular basis, the decisions, that we make, how we support, our community, our residents, how we partner with, agencies in order to ensure that we are providing equitable services that do reach across, the diversity of, again, our wonderful county that we are all a part of. Where it plays a role in, as far as the mental health perspective, is that historically we know that there are marginalized groups that live right here in Franklin County who barriers could be access to care. Barriers could be, being able to afford care. Barriers can be the largest umbrella, which is stigma. Barriers can be language, like what I just, shared earlier, not just mental illness and addiction language, but also English is not my first language, and I don't even know what you're talking about because that language doesn't exist. I just don't feel well in my body or in my mind, right? And so trying to, understand all of those things at once for the totality of Franklin County is quite difficult. Trying to understand it and how it has the intersectionality between who we are as, providers, in some senses, our network providers of care, folks who are in, areas of county leadership. We can talk, about, policy and legislation. All of these things have such a grand impact on the scope of how we are even positioned to provide care for, I'll just say, minority groups here in Franklin County, or marginalized groups in Franklin County. And then the second part of your question, you referenced, what was it, Leandra?
The diversity, equity, inclusion, how that plays a role, as well as
Just
the barriers families and individuals can face.
Okay, so I think I pretty much covered, a lot of those, those barriers. They're pretty individual, but they're also systemic at the same exact time, which makes it very hard. I mean, I feel like everybody on this call knows that it is very hard to be that support, ideally, that we want to be, but that does not keep us from striving in that direction toward health and healing and wholeness for everybody that we're responsible for.
And I would like to piggyback on what Dr. K has said. About a month ago, the Somali community, the Imams, came to NAMI Franklin County and wanted to begin to partner with us. And I am a praying woman. And what I decided to do is I told them, absolutely, we can partner. But I had to understand how I was going to approach the Somali community, because typically, being this woman that I am sometimes can be overwhelming for someone. So what I decided to do is to take a couple of my partners and colleagues with me and meet with the Somali imams. And what I said to them, I want to listen to your story. And then we can continue our conversation, but me opening up to hear what your needs are and what your community is like is real important for me. So,
I love that. And I think that cultural humility is one of the biggest things as providers that we can take with us. So acknowledging that we don't know everything. We don't know what it's like to experience everything, but knowing that we have the we don't know everything and we absolutely have the capacity to learn. So acknowledging all of the risk factors, all of the different considerations when it comes to working with families, what a family may have experienced before they've even walked in the door. And even the cultural considerations when we're thinking about what the views of mental health and help seeking are, trust in providers and mental health providers, or just in hospital medical system as a whole. And what is the definition of mental illness for that family? And so those are all things of when I think of just having that cultural humility, knowing that we do not know everything, and being open to educating ourselves and providing space to be able to learn that as providers. I think that's our duty. And when we were talking about barriers, I think something else that came to mind for me was, especially after COVID, there was this abrupt switch to telehealth. And, some of our families that needed help the most, when we're thinking about things like technology, bandwidth to be able to do that, it just understanding technology. Right. So, and then you add in the piece there that there are families that when they're coming to our offices, they we're using interpreters right there in the same room, navigating that. So I think COVID, really highlighted some of these disparities that were there. And it were just things that, yes, we rolled out telehealth, and it was amazing that we were able to provide those services for families and keep families connected. But not all families had that ability. And so I think just always keeping that in mind as a provider, to be able to take a step back and see, what are we looking at here? What are the considerations in this case? And I just feel very strongly that as mental health providers and just providers in general, physical, medical health as well, it's our duty to constantly be acknowledging that and recognizing those barriers there.
Yeah, I definitely would co-sign what you said about telehealth. I mean, I was one of those people that was in the throes of, hey, you have an entire team that has, caseloads, and we have to switch to telehealth right now. I'm sorry. How do we do that? What is that? So, so clinicians and, I was a clinical director at the time, having to absorb this whole new world of functionality and then still be there for our clients. Yeah, the telehealth transition was certainly a tricky barrier that we have, but it seems that hopefully a lot of people have been able to, to get beyond that. I wanted to kind of just tag a little bit real quick on what Rochelle shared, because Adam H has partnered with NAMI for I don't know how many years, but in the faith space, that educational component, accessing our faith leaders, our faith professionals who we know have a reach that is so far beyond what we could possibly imagine, is so critical. And so we have partnered, we have been, but we're continuing onward, this year with multiple sessions and series of opportunities to educate on mental health and addiction with our faith leaders and professionals, just all the way through to the end of the year, and then landing, into a conference space, because we know that these are key touch points for faith communities that have such a broad reach, in this space of reducing stigma, feeling welcomed, educating folks on knowing what to do in the wake of a crisis, like Ms. Rochelle brought up for mental health first aid. Soon we're going to be doing question, persuade, refer. I don't know if you've heard about that. It is a suicide prevention training for laypersons. So training up these faith leaders in spaces that they are engaged in on a regular basis is critical to this whole DEI perspective as well.
Absolutely amazing. And thank you, because you led right into the next question. And I believe it's going to be our final question. Looking at the time, we've had amazing conversation. But I also want to acknowledge a question that one of our viewers had, especially when we're talking about how we can help end the stigma and supporting especially minorities. And historically, women were disregarded with mental issues and even discouraged from seeking care. So when we're talking about how that plays in statistical purposes, of course, it's going to be a lower representation. But what can we really do to come together and end that stigma so we're getting the help is normalized and it's okay to not be okay?
Well, I would like to begin. One is to talk openly about mental health. We have this taboo about it, and it is a part of who we are. Educate yourself and others about mental health. Be conscious of your language. You can't be disrespectful when you are talking about it. Choose empowerment over shame. Don't be ashamed of the fact that you may suffer from depression or anxiety. Empower yourself. And I will defer to my colleagues because I know that they have more to say about it.
The language piece, adjusting language, I think that's huge. And sometimes things that we might not even think about. One thing that we talk about a lot with our staff here is even using language, things like, oh, that was crazy, or this is insane, right? These are things that there's a lot of stigma attached to those words. And I mean, again, these are kind of just normal statements that have become normalized, but let's try to reduce that. And really trying to catch yourself when that kind of when we're kind of having those types of statements and being able to catch yourself and identify that that's actually a stigmatizing statement. So what are some things about our language that we can adjust? Labels are another big one that we talk about. I've heard many professionals, the bipolar girl, and that's not who she is or who
Right.
they are, right?
Right.
They have a diagnosis.
Yes.
And let's try to remove that, right? That's not the only thing that makes up that person, that beautiful being. And so we have a lot of those conversations with professionals, but really in the community, when we can even try to adjust the language of our families, teach our children to do this, that's one small way that we can start removing that stigma around mental health and mental diagnoses.
I'm going to try to give my final thoughts in like 2 seconds. I jotted down a couple of things, but then you said something, Leandra, that made something else come out. Completely agree with everything that's already been said. This language component is so massive, and you're right, Gina. It starts literally exactly where we are. Like every conversation at work, at the grocery store, with family, with friends, we have to be the ones that are fearless in correcting that stigmatizing language, no matter where we are. My first thought was, just be kind. What's wrong with that? There's whole prevention curriculum that we're, teaching in schools, K through 12, about kindness. That literally still goes a very long way. So be kind, be encouraged. And you said, Leandra, about, the statistic about women. And I guess I could just end on this by just saying that, women are strong. We just are. I believe that for myself, but we hurt too. And so we may not be strong 24/7. We may be strong, 6 out of 7 days a week or half the year, but the other half is a little iffy, but we're carrying a lot. And so, we are strong, but just like any other emotional being, we hurt too. We just may carry it differently, again, individually and collectively.
Well, thank you so much. This has been great. Thank you for joining us today. Thank you to our panelists for this amazing discussion. We will be sure to post the resources that we have discussed in the chat so that you have access to them. And I also want to take the time to mention that Franklin County has a free resource called Credible Mind. And this is a platform that allows our residents to access information on more than 200 mental health topics and to find mental health providers in your area. So please access this important tool, as well as the others that we have highlighted in today's discussion. And remember, above all else, it is okay to not be okay. And it's time to start having these important conversations and begin improving our mental health and our well-being. Take care, and everyone have a wonderful day.